Our doctors who are putting their lives at risk to fight coronavirus are now being targeted by COVIDiots. You have a mob that resorted to large-scale stone pelting against doctors in Indore. The mob can be seen pelting stones and chasing away doctors who were there to help them to test those locals for coronavirus. 4 people have been arrested now for this ghastly assault on doctors. This attack prompted the AIIMS resident doctors to write to the Home Minister Amit Shah seeking action against the attackers and safety for the medical staff. Unfortunately, it is not just in Indore. Similar such incidents have come to light in Hyderabad, in Bengaluru, in Bihar. Health department survey workers were attacked in Bengaluru's Sadikpalia during a survey for those who had any symptoms of coronavirus. In Hyderabad as well, the relatives of COVID-19 patient attacked a doctor inside an isolation ward. And in Mumbai district, a medical team was attacked when they tried to visit a family suspected of having coronavirus. It's absolutely bizarre. It is absolutely uncalled for all these COVIDiots to go ahead and attack the doctors and the healthcare professionals at this stage in India. We are also getting some reactions coming in from doctors as well. The AIIMS doctors have also expressed concerns. Listen in first to what the doctors are saying.
तो उन्होंने आए, हम लोग ने जैसे ही पूछना शुरू किया, पत्थर फेंकना शुरू कर दिए दोनों। वो अच्छा हुआ और पूरी फोर्स भी थी, सो दैट्स व्हाई हम लोग बच के आ गए, अदरवाइज बच नहीं सकते थे।
पत्थरबाजी करने कुल कितने लोग थे भीड़ में? जो महिला पुरुष दोनों थे कि
देख नहीं पाए, हम बहुत डर गए थे। पत्थर हमारे पैर पे जोर जोर से पड़ना शुरू हो गए, तो हम कार में अचानक सर लेके हमको निकल गए।
जिसको पुलिस ने काफी गंभीरता से लिया, तत्काल उसमें प्रकरण पंजीबद्ध करके जो उसके मुख्य आरोपी, उसमें जो 4 लोग थे जिनका इस घटना के पीछे मुख्य रोल था, उन 4 लोगों को पुलिस ने गिरफ्तार भी कर लिया है। इसमें कुछ अन्य लोगों को भी वीडियो फुटेज के माध्यम से पहचान की जा रही है और उनके विरुद्ध भी कार्रवाई की जाएगी।
Heminder is now joining us live from Madhya Pradesh. We also have Nolan Pinto who will be joining us from Karnataka and Ashish Pandey as well who will be joining us. Heminder, first I'm going to come to you. What is wrong with these people? These are healthcare professionals. These are doctors. Why have they gone ahead and attacked these doctors? What are they thinking and what is the kind of action that the Home Ministry has decided to take against these COVIDiots?
Well, as far as action is concerned, the police has already acted. They have registered a case and 4 people have been arrested. More arrests are likely to happen very soon. So the police have already tried to send across a message that those people who come in the wake of law, those who don't allow these health workers to perform their duties, they would be arrested. Swift action would be taken against them. As far as their action is concerned, these people are concerned, they are obviously not aware of the ramifications of what they are doing. One, they don't know that if they are not in isolation, they are likely to spread the virus, which is happening in Indore. And this particular area is the hotbed. This particular area, in fact, in Indore, 76 patients have reported positive out of a total of 99 in Madhya Pradesh. And this particular area, Ranipura area, has given the maximum number of patients in Indore. So how this is happening and what the government needs to do remains to be seen, but the fact is that these people are also angry and frustrated with the fact that there is no emergency service available for them. When the doctors went there, they vented out their frustration, coupled with the fact that there is no knowledge with these people. They don't realize that the ones who have come to them as their saviors, they are attacking them only. So absolutely the government has acted, and now it's people are in Indore hoping, because religious leaders and community leaders from all across all sections of society, they have come out and condemned this incident and have asked people to cooperate with health authorities. So better sense is likely to prevail.
Well, we'll wait and watch to see whether better sense prevails or not, Heminder. But Nolan Pinto is also joining us live from Bengaluru. Nolan, I believe a similar such incident has taken place in Bengaluru as well, where people have gone ahead and attacked innocent doctors and healthcare professionals who are there to, mind you, help them. We refuse to believe that the people cannot differentiate between who's there to help them and not there to help them. When a doctor comes to check you, obviously the doctor is there to help you out. He's a healthcare professional. What is the kind of justification that the people are giving, resorting to such violence against doctors, and any kind of action coming in from the administration against them as well? They should be taken to task.
Chari, these are ASHA workers. They are basically healthcare volunteers. They act as an interface between the community as a whole and also the healthcare system. Now, they went to this particular area because, this is according to the Deputy Chief Minister, Harinarayan, who's also a doctor. They went over there because one lady who was working as a maid fell sick and she was COVID positive. So they went to that particular area to ask people to do a survey. If anyone has symptoms, asymptomatic, tell them to take precautions, so on and so forth. When they went over there, the mosque, in fact, informed through the announcement system, informed the people not to allow them to do their work and to surround them. More than 100 people, this is what they alleged, surrounded them, heckled them, attacked them, used abusive words. Thankfully, because the police reached there on time, they are safe. Now, Chaiti, this is not ignorance. This PDS, the public distribution system, is providing all the BPL card holders whatever is necessary. Those who don't have food, cooked food is being provided by NGOs. Those who don't have groceries, groceries is being provided. And yet, if they do this, they need to be taken to task. There is absolutely no excuse for this.
All right, Nolan, thanks much for bringing our viewers up to speed. Heminder, thanks for bringing our viewers up to speed. We'll stay on the story and keep getting you all the very latest details against and the kind of action that the administration is going to be taking against these COVIDiots who are aimlessly going ahead and attacking people for no rhyme or reason, attacking healthcare professionals, mind you, while at it. Now, shocking visuals have emerged from Mumbai's Dharavi. A group of young men were seen abusing policemen after being told to follow lockdown orders and stay at home. The youth can also be seen ganging up against the police and threatening them. They even pelted stones, hurled abuses at the cops on duty. 2 people have been detained so far. The remaining accused are on the run. Dharavi is Asia's largest slum area, and the latest coronavirus cases in the area have triggered community spread fears. India's financial capital, Mumbai, is now emerging as one of the major coronavirus hotspots with over 200 confirmed cases. A fresh case was reported from Dharavi, the largest slum area in the city, triggering community spread concerns. The patient is a 54-year-old sanitation worker. This after a 56-year-old man from Dharavi passed away yesterday. The youngest patient of the city is a 3-day-old infant. This, in fact, allegedly caught the virus as he allegedly caught the virus as he was kept on a bed vacated by a coronavirus patient at a hospital in Mumbai's Chembur. The family has now blamed the hospital for carelessness. The mother and the infant are now undergoing treatment at Mumbai's Kasturba Hospital. An Air India crew member also tested positive for coronavirus. The official was involved in one of the evacuation operations conducted by Air India. In Navi Mumbai, 5 CISF Jawans have been tested positive. Maharashtra continues to be the worst affected state in the country with 280 active cases and 16 deaths so far.
I'm at the famous Marine Drive promenade of Mumbai. This promenade today wears a deserted look. Have a look around. It looks scary. On the left-hand side from where I am standing is the famous Nariman Point. But there is no one around. I see a policeman guarding the area. Other than that, I don't see anybody. Now slowly on my right-hand side, there is the Girgaon Chapati. But through the entire promenade, I don't see anybody. Would you believe this is the very place, the iconic place which attracts thousands and thousands of not just Mumbaikars, but the tourists from world over. But today, there is no one around. The fear of COVID-19 has kept the tourists far and also the Mumbaikars indoors. This is a very scary kind of a situation. This Mumbai scares everyone. In my last 15 to 20 years in Mumbai, I have never seen such a scary Mumbai. But Mumbaikars, even though who are indoors, are resilient. Mumbai is resilient. Like all the times, it will fight back, it will bounce back, and Mumbaikars want to see their all bright, brimming, chirping Mumbai as it is known to everybody. With camera person Mahesh More, this is Pankaj Upadhyay in Mumbai, reporting for India Today.
Divyesh Singh is now joining us live. Divyesh, you know, this was a matter of big concern from the start, that Dharavi is Asia's largest slum, and you see the way people are staying in Dharavi. There is not much distance between two homes as well. It's a massive cluster of people below the poverty line residing in Dharavi. When you have one person who gets this test positive in Dharavi, there is a fear of a community spread. Community spread is the worst thing that could happen at this point of time. So now, what are the authorities doing who have swung into action to contain this particular community spread fear? Because there is a 54-year-old man living in Dharavi, tested positive. 56-year-old man in Dharavi already lost his life, and the latest coming in is a 3-day-old infant.
See, the authorities in Mumbai are now trying to contain these areas where there's a fear of community spread, especially areas and ghettos, clusters like Dharavi, where we have dense population, people staying in houses which are barely 6 by 6 or 7 by 7 square feet. They are small cluster, tiny houses. There's not much difference. People pass through tiny lanes which are barely 1.5 feet or so. Then there are very fewer roads, while the whole slum pocket is located in a tightly constructed area, in a closely constructed area where the community spread, is the biggest concern. Sanitation workers, BMC workers have fumigated the area. Disinfectants have been sprayed so that infection could be contained. But the biggest challenge again remains Dharavi, a densely populated slum pocket where people stay very close to each other. Each and every house is just separated by a tin shed which is barely not even half inch thicker. Also, after the two cases where the 56-year-old person and the 54-year-old person found testing positive COVID-19, the area has been contained. The area has been sealed for people staying inside. People have been requested to stay indoors, and all the essential commodities will be supplied to them door to door by BMC and police officials. We also saw that there was a bunch of Dharavi residents who attacked the policemen because they asked them to stay indoors. They attacked them, they hurled stones at them. 2 persons have been arrested in that case.
All right, Divyesh, leave it at that. We'll continue getting you all the updates from the financial capital, where the community spread fear is existent at this point of time, because a person in Dharavi has now tested positive. One person in Dharavi has already lost his life. Now, while the debate is still on whether everyone should wear a mask or not, the CDC in the US has now taken a U-turn and claimed that masks are essential. This, as the World Health Organization claimed that only healthcare professionals need to wear masks. So what should you do now? We break it down for you in this report.
A global scramble for masks. This despite the official advice from the WHO not to wear them if you aren't sick and aren't caring for coronavirus patients or suspects. America's Center for Disease Control and Prevention is now likely to change the official guidance. The CDC is considering recommending do-it-yourself cloth coverings. You don't need surgical or medical grade masks. But homemade facial protection like this isn't a bad idea if sewn in safe and hygienic conditions. Many in India have now also begun to believe any mask is better protection than no mask at all. Dr. S.P. Biotra of Delhi's Sri Gangaram Hospital endorses wearing homemade masks amid the pandemic.
We don't advise everybody to wear N95. N95, yes, especially we are taking a special precaution. People who are dealing with the patient, people in a critical care, people in the casualties, people at home. You can take a normal cotton cloth, put 4 strings over there and ladies can use their dupattas. We take our hanky, put over there. They will at least we can protect others from suffering. When we are coughing, our droplets will not go that far off.
Officially though, India is still guarded about facial protection. The government's thrust remains on social distancing. Health authorities at the same time have indicated new guidelines may soon be issued about homemade masks.
हर लोगों को अवगत करना चाहते हैं कि मास्क सबको पहनने की जरूरत नहीं है. आपको मास्क से भी ज्यादा जरूरी है कि आप अपनी सोशल डिस्टेंसिंग 1 मीटर तक का डिस्टेंस रखें और आपको अगर कभी खांसी और उस तरह से खुद हो तब आप मास्क पहनें.
Social distancing is indispensable in the fight against COVID-19. For people, masks serve as an additional physical barrier against infection.
Experts say that you don't need a N99 or N95 mask to protect yourself from those who may have developed symptoms of COVID or those who may be coughing, because the size of the virus is bigger. Hence, a normal cotton cloth or a normal covering for the mouth would also do.
Daily mask wearing is a social etiquette standard in East Asia. Japan, for example, produced more than 4 billion masks for private use alone in 2018. Some say it's probably Japan's mask culture that's helped the country slow the spread of coronavirus despite having multiple hotspots. India has no culture of mask wearing. But as the pandemic worsened, ordinary Indians have embraced the protection on their own. With Milind Sharma, Bureau Report, India Today.
New York has become the epicenter of coronavirus in the US with over 80,000 cases and over 1,900 deaths. The pandemic has forced millions of New Yorkers into their homes as local and state governments enforce another 30-day stay-at-home order to try and flatten this curve. My colleague Gurmeet Sindhu brings you this report from America's hotbed.
So we're in one of the local grocery stores in the area, and as you can see, they had posted a sign outside that said they will only allow 5 people at a time into the store. So if one person leaves, only then can one next person come in. So they're taking all the precautions that they can from their side to make sure that the area is safe and they can contain the virus to best of their ability. Mostly all the grocery stores in this area, be it Western or Eastern or any grocery stores, most of them have shut down, and it's becoming very hard for people to go out and get their basic essentials of everyday groceries to feed their family.
We want to serve the community, we want to serve the local residents, the neighbors, because those who are helping us 365 days, and in this tough time, I just don't want to close the doors and just sit home. Getting merchandising from the wholesalers is also tough now, and then after a month we're going to get difficulties that the products coming from abroad it's not going to be available, like all the flours that basic people eat, attas and everything is going to be a little tough from next couple months.
It is scary. Can't wait for it to get back to normal.
Yeah. Do you have family back in India?
Yes, I do. I'm worried about them too.
Okay. And do you know how things are going with them? Are you able to talk to them?
So far they are good, but we are still worried. Like, I hope it doesn't go as crazy as it went here, because they don't have arrangement to fight with all that.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.